In episode 3, we're going to talk about why the Free Market Medical Association is beneficial to the employers as well as the employees. Hi, Dr. Chris Main here, board certified orthopedic surgeon at Midwest Bone and Joint Center. Over the past several years, it's cost you a lot of money, or your employer a lot of money, to provide you with health insurance. In this type of model, they're able to pay for outpatient procedures through a self-insured model with much less cost. The biggest advantage is the fact no costs are hidden. If you have a problem, we tell you exactly what it's going to cost up front. If you're an employer or a managing supervisor and one of your employees gets hurt and requires medical care, if you send them to a hospital-based facility, you have no idea what that's going to cost. If someone tears the rotator cuff, tears some cartilage in their knee, you may have no idea what it's going to cost to go through an MRI, an evaluation, or even a surgical procedure. When you look under our model, you know right up front what that cost is going to be. And when you work with us through a self-insured plan, the cost overall is significantly less than what it would be if you use a hospital setting. On average, the cost associated with healthcare provided through a hospital setting is 400% higher than what you can pay through a Free Market Medical Association facility. This plan was first developed in 2007 by the Surgery Center of Oklahoma. Over the past 8 years, that facility has contracts with 49 states across the country. That should tell you right there, this model works, and it can work for you and your employee. This type of model has been developed for self-insured companies and their employees. It's not something that we utilize on workers' compensation carriers. We developed our practice that takes care of a lot of work comp patients over the past several years. However, this is another added advantage outside of a work-related injury to your normal employees. It's something that if you have an injury such as a rotator cuff tear, you tear some cartilage in your knee, you have a badly sprained ankle, you can come see us on your own health insurance through your employer to save money and costs. Over the past few years that this market has been developed, a lot of employers have been able to significantly reduce their healthcare costs to insurance carriers. This is something that they want to pass on to their employees by being health conscious, really looking at each other's benefit packages, and providing what's going to be the most optimal coverage and care for you and your families. This transparent model is something that if you need a procedure performed, you know exactly right up front what the cost is going to be.